Welcome to Vertical Movement PT. I'm Dr. Cindy Kimmy, physical therapist, and today we are going to work on a physical therapy routine to help with plantar fasciitis. The idea of this video is for it to feel like as if you and me are together and you're following step by step so that we can go ahead and achieve your health goals. So go ahead and find a comfortable open spot, put on something comfy, and dedicate some time just for yourself so you can focus on your health. All right, let's go ahead and get started. Plantar fasciitis is the disorder of the plantar fascia, and plantar fascia is the connective tissue that supports the bottom of your arch, and it connects right here to the base of your calcaneus, so your heel, and connects to the base of your toes. So it's kind of just like that. And plantar fasciitis was once thought to be due to the inflammation of the plantar fascia, but recent research shows that it's actually micro tears in the plantar fascia that's causing the pain. Plantar fasciitis is caused when there is an overstrain on the plantar fascia and it causes micro tears. So activities such as long distance running, or if you just started working out and you haven't worked out for a long time. It could also be from gaining a lot of weight suddenly or being obese. It could also be due to standing for a long period of time. So if you have a job that requires you to stand, or you're doing some sort of activity or hobby that requires you to stand for a long time. A few important tips. One, you want to make sure you stretch your foot before you get up in the morning or before you get up from sitting for a long period of time. That will save you from that sharp stabbing pain when you take that first step. Two, you want to make sure you wear shoes that have a good arch support or good support. So avoid flip-flops or shoes that you can fold in half, and try to wear shoes such as tennis shoes. Three, you want to make sure that you do your exercises. So you could do this routine 3 to 4 times a week for 6 to 8 weeks. Most people, they get better from plantar fasciitis with conservative care. And if you're finding that this routine is not working or you're not improving, I highly recommend going to see your local physical therapist, because you need an assessment and an individual plan that's just for you. This is the soft tissue mobilization portion of this routine. This is Boo, my Ottoman, and he's going to assist me by being my chair. So what you're going to do, you're going to grab a ball, like a tennis ball or a lacrosse ball. A golf ball will work also, but it's a little bit kind of rough, so I do recommend a tennis ball or a lacrosse ball. And what you're going to do, you're just going to place it on the ground, and you're going to just roll it along the fibers of the plantar fascia. So remember, the plantar fascia connects from the base of the heel to the base of the toes. Roll back and forth, and when you find kind of like a sore spot, you can go ahead and sit in that spot. You can even do circles counterclockwise and clockwise. These fibers, they do not only run in one direction. And for plantar fasciitis, there is research showing that the collagen in the plantar fascia, the fibers are disorganized. So this is a great way to break up those fibers to help it to reorganize itself. One thing I like to use other than the ball is an ice ball. So you can put a towel on the ground so that the floor doesn't get wet. And I like to use a whiskey ice ball. You could also freeze a water bottle. I'm just going to place that there, and it's the same idea with the ball, except this helps reduce the pain. And even though recent research shows that it's not the inflammation of the plantar fasciitis that's causing the pain, but it's more of the micro tears, I do believe there is some inflammation in the area just from the strain. So the ice can help calm that down. But most importantly, help with that pain that you're feeling. And just make sure with the stages for ice, you're first gonna feel kind of like an itching sensation, then burning, aching, and then it will go numb. And when it goes numb, you just want to roll out for maybe another 30 seconds to a minute after that and then stop, because that's your goal. So it shouldn't be any longer than like 3 to 5 minutes. Okay? So right now you can go ahead and stop the video and pause it if you want to roll out a bit longer. And then start it so that we can continue to our next section. For our next technique for the soft tissue mobilization portion of this routine is using a foam roller. And as you know from my other videos, I love foam rollers. I think they're awesome, and it's great that you can use them for pretty much every part of your body. So if you don't have one, I highly recommend purchasing one. So for this part, we're gonna go ahead and foam roll our calf muscle. And that's important because the calf is consisted of 2 muscles, and that's the gastrocnemius, which is on the top, and the soleus is underneath. But both of those muscles connect to the Achilles tendon, and the Achilles tendon attaches to the heel. So since we know that the plantar fascia connects right here to the heel, it's all connected. So the theory behind loosening up the calf muscle is to help relax the tension from the plantar fascia. So what you're going to do, you're going to place the foot that's causing you the pain, you're going to place that calf on the foam roller. And for those of you who do not have shoulder injuries, you can go ahead and lift up to add a little bit more body weight and pressure on the calf. You could also stack your other leg on top of the leg that's on the foam roller, and you can roll up and down, going down towards the Achilles and up towards the origin. So origin means the beginning of the muscle, and insertion is where it ends, or the connection. Okay, and when you find a sore spot, you can go ahead and stop there. One thing that I like to do, I like to add ankle pumps when I'm on a sore spot of my calf. So right now I'm on one and I'm trying to keep a straight face, but the ankle pumps really helps to glide those muscle fibers and to help release that restriction on the calf. If this is too much lifting up your butt, you can go ahead and just lay down and roll it. And this is still very effective, and yes, also very sore. So right now you can go ahead and pause the video if you want to roll out for a bit longer, and start it when you're ready. Now we're going to go ahead and move on to the stretching portion of our routine. Our first stretch is going to focus on stretching the gastrocnemius, and that's one of the 2 muscles of the calf muscle. So the gastrocnemius, it connects on the condyles of the femur. So the femur is the thigh leg bone here, and the gastrocnemius connects here on the condyles. And then that's the origin, and the insertion is on the Achilles tendon right over here. So what you're going to do to stretch out the left calf, you're going to go ahead and make sure the back leg is straight, and the right leg, you're going to go ahead and lean forward into a lunge until you feel a nice stretch in the back of that calf. You can go ahead and hold on to something. I'm holding onto the wall here for balance. And then you want to hold this stretch for about 30 seconds. You want to avoid any sensations of pain, and you don't want to overstretch the muscle. So this is not something for you to push through or to fight the pain. You just want to go ahead and get a nice stretch in the calf. And then as the muscle loosens up, you can go ahead and lean a little bit more forward, getting into that deeper stretch, and then relax. Okay? So next, we're going to go ahead and stretch out the soleus muscle. And that's the calf muscle that lies underneath the gastrocnemius, and it connects onto the fibula. So the fibula is the outside bone of the lower part of your leg. And then it also connects on the medial portion. So medial means closer to the middle, the medial portion of the tibia. So the tibia is the lower part of the leg on the inside. Tibia, fibula. And then, so that's the soleus. And then it connects down, and just like the gastrocnemius, it connects onto the Achilles tendon. Okay? So how are you going to stretch that muscle? You're actually going to go ahead and bend the knee in the back. Okay? so since the soleus doesn't cross the knee joint, you don't have to have it be straight. And then you're going to go ahead with the left knee bent, you're going to lean forward. So what this does, it puts the gastroc medius on slack. So you could focus on only stretching the soleus. So you're going to go ahead and hold this stretch for 30 seconds. And as the muscle loosens up, you're going to go ahead and lean deeper into the stretch. And just as a reminder, make sure you never push any of your stretches. Also, something else that I see in my patients is this bobbing kind of motion, like they like to bob when they stretch. Don't do that because that's called ballistic stretching, and that actually causes the muscle to tighten up more. What you want to do is do a static stretch, which means you stay still without the bobbing. Okay? And then relax. Our next stretch we're going to do is the plantar fascia stretch. So if you're having the pain on the left foot, what you're going to do, you're going to get your hands here, grab your toes, and bend it back towards your shin. So this is your shin. You should feel a nice stretch on the base of your arch here at the base of your foot. And you're going to go ahead and hold that stretch for 30 to 45 seconds. One thing that I like to do while I'm stretching the plantar fascia, I like to also work and do a little bit of soft tissue work along the plantar fascia. So you can go ahead and work your way, and just remember plantar fascia connects to the base of the toes. So you can kind of use that as a landmark, going from the big toe, second toe, third toe, and just kind of work your way and work it all the way towards the heel. Okay. So this is a great stretch to do first thing in the morning, or to do it right before you get up after you sat down for a while, like as if you were sitting down for a long movie. Okay, so our next stretch that I like to do is a downward dog stretch. I'm gonna tuck in my shirt here. And I love this stretch because it stretches out the whole posterior chain. And the posterior chain is the glutes, hamstring, and the calf. You're gonna go ahead, hands on the ground, and bringing your bum in the air. You're gonna go ahead and gently drop your heels down to the ground. And I like this stretch because plantar fasciitis, it's not caused from the plantar fascia, but it's caused from other parts of your body having some sort of impairment. From your calf being tight, or from your hips not being stable enough, and it's causing your foot to rock back and forth when you balance. So the idea of the downward dog stretch is helpful because it works that whole posterior chain that could be affecting the plantar fascia. So what you're going to do, you're going to go ahead and try to drop your heels down as much as you can without pain. And as your muscle loosens up, you're going to allow your heel to sink down lower and lower. You're going to go ahead with your knees straight. I think mine are kind of bending a little bit. I'm a little tight. You're going to hold it for 30 to 45 seconds. Next, we're going to go ahead and move on to the strengthening portion of this routine. So our first strengthening exercise is going to be calf raises, and that's going to strengthen our calf muscle. So you can go ahead and hold onto something, or bring a chair in front of you so you can hold onto that. You're going to go ahead and raise up on your tippy toes and slowly go back down. And up, and slowly back down. You're going to go ahead and do 20 of these. And up, and slowly. So this is important because it helps strengthen the gastrocnemius, and that can help reduce the effects of plantar fasciitis. Up and down. Up and then slowly go down. So faster isn't better, but doing this slowly is better. So then you can really engage all of the muscles. Rather than fast, you can most likely have bad form, or you can brush it, can lead to an injury. So probably after 10, you should start feeling a little bit of burning or like a warm sensation in your calf. And what you want to do, you want to repeat this for 2 sets of 20. Okay? We're going to go ahead and do about 5 more. If you find that it's hard to go too high, you can just go ahead and go what you can. And then slowly work your way up, going higher and higher once you're tippy toes. Okay, and last one. So our next exercise we're going to do, we're going to do towel curls. So Boo is back to assist me with this exercise. And you're going to go ahead and grab a towel, a hand towel, place it on the ground. And what this exercise does is strengthens the intrinsic muscles of the arch of your foot, and that helps to support the arch. That way your plantar fascia isn't taking all of the weight and all of the blame for this injury. By strengthening the foot intrinsic muscle, that helps strengthen the foot arch, and then your plantar fascia can take a bit of a rest. Okay? So what you're going to do, put the towel on the ground. You're going to go ahead and curl the towel with your toes, just like that. Bring the top of the towel down, and then you're just going to go ahead and repeat that. You just kind of want to take your time and make sure that the bottom of your foot doesn't cramp. You're going to go ahead and repeat that for a total of 5 to 10 times. This one is very important. It's tedious, but this is what's going to help the plantar fascia, and it's going to help, I guess, take the load so that the plantar fascia doesn't have to do all the work. Just make sure all of the toes are working, grabbing the towel, and it's not just like the big toe. Or I have some clients and patients who cheat and they do this. They use like their hamstrings to bring the towel down. Don't do that. Make sure it's your toe muscles. But yeah, so that completes the last exercise. And I highly recommend doing this whole routine 3 to 4 times a week for 6 to 8 weeks. But I'm so glad that you have joined me here today, and I can't wait to see you.